Have you ever wondered what it would feel like to live in a country where going to the doctor doesn't fill you with dread, not because of the illness itself, but because of the bill that comes afterward? For many Americans, healthcare isn't just a service, it's a gamble. A gamble that could cost tens of thousands of dollars, even for something routine. In fact, the United States is home to some of the highest medical bills in the entire world. And for some, it's become unbearable. Imagine working your whole life, paying into health insurance, and still being told that you owe thousands of dollars after a surgery or hospital stay. Imagine being forced to choose between paying rent, buying food, or filling a prescription. These are not rare, isolated cases, they're everyday stories for ordinary Americans. And that's why a growing number of them are making a drastic, almost unthinkable choice, leaving their country behind and moving overseas to find affordable, reliable healthcare. In this video, we'll take a journey into that world. We'll explore why US healthcare costs are so high, how they impact families, and we'll meet real Americans who decided that the only way to survive was to live somewhere else. We'll compare systems, analyze the numbers, and look at the emotional toll this crisis has created. Most importantly, we'll ask, what does it mean when people feel they must leave the wealthiest nation on earth just to see a doctor without going broke? Let's start with the reality in the US today. The average American spends about $12,000 a year on healthcare. That's not a luxury plan, that's the average. A simple ambulance ride can cost over $3,000. A single night in the hospital? $10,000, sometimes more. And if you need surgery, let's say a hip replacement, the bill can easily reach over $100,000. Even those with health insurance are not safe. Deductibles, co-pays, out-of-network fees, they all add up, leaving people with bills they can't pay. The result? Over 60% of personal bankruptcies in the US are linked to medical debt. Think about that. People aren't losing their homes because they gambled it away, or because they made reckless financial decisions. They're losing everything because they got sick. Now, let's put a human face on this crisis. Take the story of John and Maria, a couple from Texas. For years, they struggled with skyrocketing insurance premiums, paying over $1,200 a month. But even with insurance, they dreaded every trip to the doctor because they knew it would lead to another bill. Eventually, they reached their breaking point. They packed up their lives and moved to Mexico. Today, with the same amount of money they used to spend just on insurance, they now cover rent, groceries, and private healthcare. And here's the kicker. When they need a doctor, the doctor often comes to them, house calls that would be unimaginable in the United States. Then there's Mary, a 62-year-old retiree. In America, she couldn't afford to stop working. Her prescriptions alone were draining her savings, costing hundreds of dollars each month. When she moved to Costa Rica, her life changed overnight. The same medications were available for a fraction of the price. Her healthcare costs dropped to about 1/5 of what she used to pay, and suddenly, retirement wasn't just a dream, it was her reality. Today, she lives in a peaceful community surrounded by other retirees who made the same choice. For Mary, moving abroad wasn't about escaping America. It was about escaping the crushing weight of America's healthcare system. And it's not just retirees. Younger Americans, too, are making the leap. Many of them are digital nomads, people who work remotely while traveling the world. In Thailand, Vietnam, or Malaysia, they can live comfortably on less than what they'd spend just on rent back home. And when it comes to healthcare, they're amazed. A doctor's visit costs $20 to $50. A dental cleaning might be $30. Even surgeries can cost just a fraction of what they would in the US, sometimes less than the deductible alone. For these younger Americans, moving abroad isn't just about money, it's about freedom. But what's so different about these countries? Why is it that healthcare in the US costs so much more? To answer that, we need to look at the systems. In Canada and most of Europe, healthcare is publicly funded. Citizens pay through taxes, and in return, they don't face the same crushing bills. In Mexico, Costa Rica, and many parts of Asia, private hospitals offer high-quality care at prices so low that even paying out of pocket is affordable. In fact, a growing trend called medical tourism has people from around the world flying to countries like Thailand, India, or Vietnam for surgeries, because even after paying for airfare and hotels, the total cost is still lower than in the United States. Meanwhile, in the US, the system is riddled with inefficiencies, middlemen, and inflated prices. Drug companies set prices far higher than anywhere else. Insurance companies add layers of bureaucracy. Administrative costs skyrocket. The result is a system that consumes nearly 20% of the entire US economy, but still leaves millions uninsured or underinsured. And despite spending more than any other nation, America's life expectancy lags behind. In fact, Americans live shorter lives, on average, than people in countries that spend half as much on healthcare. This paradox leaves many Americans asking, is it really worth it to stay? That's why thousands are looking abroad. For them, moving overseas isn't running away, it's survival. It's about finding dignity in healthcare. It's about living in a place where a broken arm doesn't mean broken finances. Where a prescription doesn't feel like punishment. Of course, moving abroad isn't easy. It comes with challenges, language barriers, cultural adjustments, being far from family. But for many, those challenges are worth facing if it means peace of mind. Think about the relief of knowing that if you have a medical emergency, you won't have to sell your home or max out your credit cards. For people like John, Maria, and Mary, that peace of mind is priceless. And here's the deeper issue: should people really have to make this choice? Should Americans, living in one of the wealthiest nations on earth, have to leave their homeland just to afford basic healthcare? Or should the US finally confront the flaws in its system and reform it so that ordinary citizens don't live in fear of getting sick? The debate is far from over. Some argue that the US offers the best medical technology and the most advanced treatments, and in many ways, that's true. If you can afford it, American hospitals can provide cutting-edge care. But what good is advanced medicine if most people can't afford to access it? A system that works only for the wealthy isn't really working at all. And so, the exodus continues. Retirees, families, and young professionals are finding new lives in countries they never thought they'd call home. For them, healthcare isn't just cheaper abroad, it's humane. It's accessible. It's fair. So as we close, I want to leave you with a question. What would you do if faced with the choice? Would you stay in the US, struggling to keep up with endless bills, or would you take the leap, move abroad, and reclaim control over your health and your future? This isn't just about money. It's about values. It's about dignity. It's about asking whether the richest nation on earth can afford to do better for its people. And if it can't, or won't, then maybe it's no surprise that more and more Americans are finding their future somewhere else. If this story made you think, share your thoughts in the comments below. Have you ever considered moving abroad for healthcare? Do you think the US can change, or is the system too broken to fix? Let's start the conversation. And if you found this video valuable, don't forget to like, share, and subscribe for more in-depth explorations of the stories that shape our lives. Because in the end, healthcare should not be a privilege. It should not be a burden. Healthcare should be a right, and until that day comes, the question remains: how many more Americans will leave in search of it?